The first doses of the Pfizer coronavirus vaccine are on their way now. Semi-trucks carrying the vaccine left a distribution center in Kalamazoo, Michigan, Sunday morning. U.S. Marshals escorted them as they made their way to the next stop. Those first doses will go to healthcare workers and nursing home residents. The vaccine is desperately needed. The U.S. is closing in on 300,000 people dead in the pandemic, and thousands more are dying every single day. CBS News correspondent Mark Strassmann has more.
Code Blue in Minneapolis, where COVID bullies Methodist Hospital every day. Its exhausted staff has a white-knuckled grip on hope.
These people are dying alone. Where is this light at the end of the tunnel? I'd like to see it.
COVID America's three major benchmarks get bleaker by the day. Deaths. Los Angeles County has had more of them than 40 states.
Over 8,000 people. Over 8,000 people who were beloved members of their families are not coming back.
Twice this week, COVID killed more than 3,000 Americans in a single day. Hospitalizations now at 108,000 patients and climbing. New Mexico's overwhelmed hospitals now ration care. Who's most likely to survive? 1/3 of Americans live in areas critically short of ICU beds.
We have 60 patients holding in our emergency department that are waiting for beds inside the hospital.
This California hospital converted its lobby into a COVID ward. But there's no easy way to create more doctors and nurses, and many hospitals report running short of needed staff. Here's why. New cases. They hit an all-time high on Friday, more than 231,000 in a single day.
The whole country's on fire. Everybody's surging. Everybody's stressed.
Which brings us to where hope lives, rolling out the Pfizer vaccine. Almost 3 million doses are shipping this weekend, bound for sub-zero freezers in all 50 states. Injections will begin tomorrow for top priority Americans, high-risk healthcare workers who've battled the killer virus the last 10 months.
We are not done until every American has access to the vaccine.
But demand dwarfs supply, and many hospitals have no idea when their vaccine shipment will show up or how much to expect. And this national inoculation will take time. Predictions call for 100 million vaccinated Americans by February. That's less than 1/3 of the country. Lana?
Wow, Mark, thank you. For more, Dr. Donald Williamson joins me now from Montgomery, Alabama. He's the president and CEO of the Alabama Hospital Association. Dr. Williamson, thanks for joining us. Now that Pfizer has been given approval for that vaccine, how soon until you hope to start vaccinations in Alabama?
Well, we actually hope that some of our hospitals will receive vaccine tomorrow, some others probably on Tuesday. And we would certainly expect vaccine clinics to start, in some cases, maybe within hours of those hospitals receiving vaccine.
You heard Mark explain that there is a shortage of vaccines given the number of people that need to be vaccinated. Do you worry that states like yours, with fewer big cities, will have to fight for access to the vaccine, particularly when the categories are expanded beyond these first two preliminary groups?
Well, I think it's always a challenge when there is a resource that's not adequate for the demand. I trust that as CDC and HHS allocate the vaccine, they'll do it in a way that's fair, not only taking into account the population, but also the risk groups and those communities that have been most severely affected by the vaccine, and allocate it in a way that does achieve equitable distribution.
I spoke with a doctor yesterday who said that there is a sizable percentage of medical personnel who have expressed doubts about getting the vaccine themselves. So, Dr. Williamson, I want to ask you the same question. Have you heard of any hospital personnel there in Alabama saying that they won't get the vaccine?
Well, we've actually had a couple of hospital systems that have surveyed their employees, and we're finding at least expressed interest between, in one system, 45%, and another system, 67% of healthcare workers who would take vaccine. I expect the uptake will actually be greater than that. But I do recognize that there are individuals who, because of the rapidity with which the vaccine was developed or for whatever other reasons, may be somewhat hesitant to take the vaccine. I do think, though, that as we move forward in this, that concern will be mitigated.
Do you plan to take the vaccine, sir?
Absolutely, as soon as I'm offered it.
And what do you say to Americans who are not in the medical profession that hear that there are medical professionals that are expressing these concerns? How do you reassure them, as well as people within your hospitals, that the vaccine is necessary to end the pandemic?
Well, we clearly know that in order to shut down any pandemic, you have to achieve herd immunity. There are really only ways to achieve herd immunity. One way to achieve herd immunity is through natural spread of the disease. We know, based on the mortality associated with this disease and the morbidity, that to achieve herd immunity through that mechanism will cause untold suffering, disability, and death. The other way to achieve it is through a vaccine. I mean, that's how we effectively have done it with measles. That's how we eliminated smallpox. And clearly, this vaccine it's been done rapidly, but it's been done in the same way we develop other vaccines, with the same safeguards and protocols. So, we are fortunate that we have the technology to do something we could not have done 5 years ago. And so we simply need to take advantage of that. Before this, I spent almost 40 years in public health. And I think this is really one of the greatest achievements in the history of our healthcare system, and especially in the history of the public health system. And it would be a tragedy for anyone to die because they didn't take the vaccine because of inappropriate concerns.
Well, even as we are starting to roll out the vaccine in this country, the projections are dire. According to Dr. Scott Gottlieb, the peak burden on hospital resources is predicted to hit around mid-January. And I saw an interview in which you reported that there were only 7% of available ICU beds statewide there in Alabama, and none actually available in Montgomery. How do you see things developing over the next several weeks?
Well, I actually think for Alabama, the next 6 to 8 weeks are going to be the bleakest in our healthcare history. We are now 500 patients per day in hospital higher than we were during our summer peak. We are seeing record high number of cases. For us, that's somewhere between 3,500 and 4,000 new cases a day. We've got 2,100 people in hospital. Probably will hit 2,500 sometime by the first of the year, and then could certainly go higher. Over the last 5 days, we've had less than 10% of ICU beds available statewide, all of which makes me very, very concerned. But it's not about beds and it's not about ventilators and stuff. It's about staff. And, in talking with our hospital administrators, what they would describe the situation as is we are holding on by our fingernails now. We can manage where we are for a short term, but if it gets worse, then we're going to be overwhelmed. And hospitals in Alabama are already in the process of eliminating urgent but not emergent elective procedures, and then trying to redeploy those nurses and other staff to help meet the surge associated with COVID.
I wrote down holding on by our fingernails because that is it's such a frightening prospect. And I do appreciate all that you and healthcare professionals across this country are doing to help us as we are still struggling with the coronavirus. I wonder, how are hospitals like yours that are already overstressed and understaffed working to accommodate both the sustained surge and this major vaccination effort at the same time?
Well, that's interestingly a serious challenge. You don't want to divert staff who are in the business of taking care of COVID patients to giving vaccination. In the strategy that our state developed, hospitals are not only going to vaccinate their own employees, they're going to be responsible for vaccinating employees in neighboring hospitals. And what we've already had as many of those neighboring hospitals as they planned together. They're volunteering their staff to come to the host hospital and do the vaccinations for their staff members when they come over. Since you have to move the patients to the vaccine, you can't move the vaccine to the patient because of the cold storage requirements.
Well, Dr. Donald Williamson, I wish you all the very best of luck. Thank you.
Thank you very much.